So today is about navigating health services, healthcare for memory and mental health problems. It's really a treat to have, I think, to be presenting with Dr. Ramirez Gomez. Psychiatrists and neurologists work together all the time, and so we're going to bring our different perspectives and kind of complement our expertise. So let's start with a vignette. You may have a father, a husband, an uncle, someone like this who's 80 years old, who's been experiencing increased anxiety, so nervousness, worry, and short-term memory problems. And he may repeat himself often and ask the same question multiple times. And he may also get lost, many times while driving. And his wife, his daughter, his niece, his family may worry. And so they accompany him and they provide a little supervision. So when you notice this in your loved ones, sometimes it can be really overwhelming. So how do you know when you need some help and some evaluation, and then where do you start? So it can be fear-inducing. So you may not want actually a diagnosis and to get evaluation because you fear the worst. And you may think that there's no cure for this, and I don't want to know. Also, identifying the problem can be difficult. So sometimes when you're older, people around you or you yourself may think, oh, I'm old. It's normal to be worried about my balance or the aches and pains I'm having, or my eyesight is not as good as before. It's okay, it's normal. Or sometimes it's also, again, scary. And there may be also family members who don't really identify the issue. And so it kind of may go unnoticed. Sometimes, too, even in mild situations where there's some memory issues, there is something called anosognosia, where you may just not have any insight into your illness. And that can occur. So then you don't really know that there is a problem. And you often say, I don't have any memory problems, and I definitely don't need any care. Sometimes too, the family can have difficulty. When your father who has been the patriarch or your mother who has been the matriarch of the family, to kind of recognize and see them have struggling with memory issues, also can kind of cause fear and also make it difficult to identify the issue and think about getting help. But recognizing it early is helpful. Simple things like, for example, when your loved one is repeating themselves a lot, and sometimes in cases where it's not recognized that it might be a cognitive issue, the family member may constantly kind of repeat and correct the person. And that can cause kind of self-esteem issues in the person with the memory issues, as well as kind of frustration, and the relationship can suffer. So I'm going to turn it over to Liliana to talk about some descriptions about memory changes.
Thank you so much, Jean. And it's wonderful what you have described because there are so many factors that influence our decision to seek help. Another factor that I like to mention too is a cultural factor as well. For example, in Latino, Hispanic families in which people live with their older adults, with the family members, and provide a lot of care and support. Sometimes it's true that we don't even realize that something is really changing because they are already paying the bills or taking them to appointments or managing things. So it's important to pay attention to all the aspects, not only of course the memory, but other components of their behaviors or other things that we are going to talk more. But one question that people ask frequently is what is the difference between what we define as normal aging versus what is dementia, what is Alzheimer's, what is the difference among all that? So we know that as we get older, we may notice some changes in our memory or other aspects of our cognition, our thinking process. But whatever those are mild and not sufficient to alter our ability to live independently or take care of ourselves, to be able to manage our finances, to plan and organize a trip or events or other things. So basically, memory loss, it's very important to have it very clear that is not normal part of aging. That sometimes, for example, uh, women around the like perimenopausal age, we may experience some difficulties with word findings or things that may vary, but they may get better, but nothing that impacts our ability to live independent. And that's the main difference. Um, Sometimes, commonly, people may forget names of people that they haven't seen in a while. But what it is not normal is to forget how something is called. For example, how they fork or how to name objects that we frequently use, or forgetting recent events. So those changes in recent memory are something that should call our attention. Uh, Memory loss and dementia, people ask, how can I take care of myself? How can we prevent this from happening? And although it is true that there are many factors that we can modify, there are certain ones that we cannot. For example, when we talk about genetics and other things, but things that we can improve and we can do to really make sure that our cognition stay as good as it could, um, as we age, include exercising regularly, any type of exercise, really, walking, having a healthy diet with we put here the example of the Mediterranean diet. In general, eating more fruits, more vegetables, more lean meats, less red meats, and using more olive oils and others. As long as it is possible, we don't necessarily need to change things drastically, but as much as we can choose healthier meals is better for our health. It's very important to have good sleep at night, stay engaged socially in groups, and keeping our mind active as well. So physically, mentally, spiritual, all aspects of our lives. And coming back to when it is concerning to have memory changes, when specific examples that could be useful is if the person that is having memory loss now is forgetting appointments or events, or like the birthday of someone that they really used to remember very well, or start putting objects in places that they don't remember, or sometimes they may start accusing other people that they are taking their things. um, Driving, as Jean mentioned, could be an issue, and sometimes people get lost because they can drive, but sometimes they have more difficulties with navigation or getting there. uh, Sometimes people could even have car accidents. That is true, and that sometimes is like the wake up call, like, oh, something is happening here. But hopefully that's not how it is for most of the people. Hopefully it's more the signs that would prompt us to have a consultation with a primary care doctor or a specialist to determine if the memory changes are normal or not. And what we put in here is a way in how we classify these memory changes. So I want to say it in big terms. As we discussed, in general, memory loss and decline in function is not normal with aging, and we give it names. People ask, what's the difference between dementia and Alzheimer's? And I always tell them dementia is a big umbrella term. Alzheimer's is one type of dementia. Dementia is uh, the loss of ability to care for themselves, to live independently. And Alzheimer is only one type. Other types are, for example, vascular dementia or dementia with Lewy body, frontotemporal dementia, or sometimes there is a mix of everything. So we characterize the continuum of the disease between normal aging, subjective concerns, which is when someone is worrying about their memory, but when we do testing, everything appears to be fine. So sometimes we call those as subjective, but I like to be careful with that name because I want to acknowledge that when people feel that something is changing, is real. So that, is a name, but I want everybody to know that we really pay attention to that. Um, and then sometimes there could be like mild difficulties with memory or major difficulties with memory that are more crossing the path towards dementia. But that's something that the doctor would determine during a visit and a detailed evaluation of the memory and other cognitive functions and additional testing. So to answer the question, what do I do? I'm worried that my mom, I think she's forgetting. Now she's not cooking the same. Her recipes don't taste the same, or sometimes she adds salt twice. Like you start worrying, you said, like, what is happening here? If you have that concern, it is okay to ask for help. And usually the first step would be to consult with your primary care doctor because they are the ones who know you the longer, they know your medical history, and they are the first one to do the basic tests to evaluate for any potential causes that could be treatable or reversible. For example, issues with your thyroid or issues with that low vitamin B12 or others. So it's good to have like a basic screening and evaluation, and the doctor may be able to refer to an specialist accordingly if they see that there are additional concerns that warrant specialized evaluation. Alternatively, if your primary care is a geriatrician or a more specialized doctor, that would be a good avenue to ask for help as well. And the workup includes not only a detailed history and the labs that I mentioned, we do cognitive testing in the office with short screening tests that help us evaluate the memory. And we also often order brain scans, different types. And with that, we are able to determine kind of in a first pass if what we're seeing could be normal or most likely not, and determine if a referral to a neurologist is necessary to start specific treatments for that and what options are available. Similarly, a neuropsychologist, which is mentioned in the last item, is a doctor, is a type of doctor, is a PhD who specializes in the evaluation of the cognitive functions. So they usually conduct more detailed testing about memory, language, and other functions of our brain that help us determine if someone has normal cognition or not.
All right. So I'm a geriatric psychiatrist and I get referrals from neurology, primary care, because there are mental health issues that are commonly associated with cognitive problems. So one thing that can happen is that when there is a diagnosis made, there can be a very severe kind of emotional reaction and demoralization associated with that. If kind of unaddressed, that can become depression, it can become anxiety, or it could be that there are some patients who express anxiety and dementia, depression and anxiety first, or at the same time as the memory concerns. And so then I may see a patient with both. So we also may do order labs, meaning, we'll ask you somewhere to get a blood drawn. What psychiatrists do is a mental status exam. Things like how are you appearing? How is your expression? What is your mood? How are you thinking? How is your speech? So that in conjunction we also think about the physical exam as well. The psychiatrist's specialty is focusing on the mental, emotional kind of functions. And then often a primary care provider can do it, a neurologist can do it, I can do it, neuropsychologists even do it. They can also refer patients, sometimes families, for support. So it can be talk therapy, psychotherapy, it could be group therapy, which exist for care partners, for example, or even persons with mild cognitive symptoms. And that's very, very important. As a psychiatrist, I would say, and the evidence in the research shows it, is that you really need both treatment in terms of medications, if needed, and also psychotherapy, some sort of counseling that enables you to kind of sometimes modify your thinking or reframe what you're experiencing. There are also other types of professionals, occupational therapists. So occupational therapists can help support function and support independence, safety. They can help, let's say, think about what types of things can you use as memory aids? A calendar, writing things down, making lists. They could also help you with, let's say, managing your medications. So how to work with a pill case so that you're still able to do it, but to avoid mixing medications up and taking the wrong ones. So occupational therapists can be very useful that way. Also for care partners too, what they can do is work with a dyad. So the person with memory issues and the care partner, and think about activities that they can do. And activities can be related to decreased agitation, improved mood. So that can be really important. Social workers also are part of the team too. They can provide counseling and they're really experts in knowing what types of services are out there to help with to help families struggling with cognitive problems, with mental health issues associated with it, and dementia. So there are some resources, and I'm going to ask Paula Garza, Paula, to speak about some of the resources that are available, which are so important. Because dementia isn't just a medical illness, it is, of course, but it is also a social illness. And people who with these illnesses and families, they live in the community. And so you want both medical care, psychosocial care, as well as community services to kind of help you manage.
Thank you, Jean. Yeah, we have a few resources that we normally recommend. So one that is very helpful is the Alzheimer Association helpline that you can call the number, the 800 number at any time. Is 24/7 helpline in different language. And you can talk with someone about a question that you have. If you have questions about what, like, you need to know if some of the memory concerns that you have or your family member has are normal or not normal. So you are looking for some help or just support as well. So the helpline is free of charge and it's just in the US, but that's an excellent resource. Another resource that we also have here in the city of Boston is through the H Strong Commission. And the H Strong Commission, they host something that is called a memory cafe. So the memory cafe is a welcoming place for people that are forgetful or they have other changes in their thinking. And the memory cafes they host them in two different areas in Boston. There is one in Gottman Square, and another one is in Jamaica Plain at the libraries. So you can look on the website, boston.gov Memory Cafe, and then you can find all the information about this resource. This is in person, and there are also a lot of other support groups that are virtual support groups as well that you can join. And this is another resource that we have on our website. So if you go to madrc.org, you can find all the roadmap series that we have. And this is one that talks some of the information that Dr. Liliana and Dr. Jean, they've been explaining a little bit more about how to do the dementia diagnosis. So you can download the roadmaps on our website. And we have the roadmaps in English and in Spanish at the moment.
So there is also what's called a Dementia Collaborative at MGH, and it is a service for patients and their care partners and families who have a cognitive disorder. So for example, I refer patients to this often, and what they provide, some of the things that they provide are, for example, a needs assessment. They can speak with a social worker who can provide information on community-based services, maybe care partner connecting with a psychotherapist for themselves, for support. So it's very, very useful. And it's in addition to the medical care, you also want other types of services to help support you. And then the community-based services that we've mentioned. We mentioned Alzheimer's Association. There are also medical daycare centers that take care of persons with dementia who may need kind of nursing support, and they may have various types of activities in medical daycare centers as well as provide meals. And it provides kind of socialization, so social interaction, which is so, so important. And then every neighborhood in Massachusetts has a council on aging, and you may know it as a senior center too. And they have so many different types of services and information that you could access and see which type of service might be right for you. So Liliana and I also want to kind of talk a little bit about tips for communicating with their healthcare providers. When you're thinking about going to see a neurologist or seeing a psychiatrist or primary care provider, anyone really, you're really going there to provide information that will help them help you. It's very useful to come prepared with questions and think about the history, think about symptoms. If you have any medical records, it's very useful to bring those as well. And understand that it could be a team of people. It may start with a primary care, but it could be a neurologist, neuropsychologist, a psychiatrist. So there may be various kinds of healthcare providers who may be able to provide services. So they may require coordination. It's very useful to keep records of, again, the symptoms of maybe what you've learned, the questions that the physician or the healthcare provider has answered, to keep record and keep you aware, but also it's something you could provide to the healthcare provider too at appointments as well. And also consider involving family or friends. I see usually a care partner and the patient. Even in cases where it's not dementia, but mild cognitive impairment, or maybe when it's depression, which can be moderate to severe, it's very, very helpful to have family or friends who know the patient well to give information. And I often talk to family members who accompany them. So don't ever be shy about being part of the appointment and providing information, because without that information, clinicians sometimes it can't be as powerful as they can be, in trying to help. And then it's always good to be kind of respectfully assertive. Sometimes physicians can be daunting to go into a clinic, and so just remember it's really important to share decision making and to kind of express, what your preferences are and discuss it with your healthcare provider. Liliana, I wonder if you have any other thoughts that weren't discussed about tips for communicating.
So that was wonderful, Jane. It's very important. I encourage you to use your voice, feel empowered to ask questions. And also in between appointments, now most of the institutions have ways in which you can be in contact with your doctor or the medical office, and you can send messages. And those can be very helpful many times when you have questions in between visits. Also, for example, something that I see relatively common is that sometimes people get lost, or it's difficult to get their follow-up appointment, or they don't know how. So it's very important to keep track when the doctor had recommended you to see you next, to discuss results or additional testing, etc. And to be on top of that, like calling the office, even contacting the doctor, trying to make sure you stay on track. Like you just don't forget about it and say like, oh, they never called me anymore, and then I didn't know what happened. So that would be another piece of advice.
Okay. All right. So so there are more resources. So this is the Caregiver Clinic, which is kind of in development at CHOIR, which is the Center for Health Outcomes and Interdisciplinary Research at MGH. And it's gonna be a clinic that provides treatments for care partners and dyads, so patients and their care partners together, who are managing cognitive concerns or any neurological problems. And Paula, I wonder if you want to give some information about MADRC and the registry.
Yes, sorry, 1 second. So this is our phone number. You can give us a call at any time if you have questions as well. So this is the number 617-278-0600. We also have social media, so you can find us on the different channels on social media. We have a YouTube channel as well that you can watch all the recording of our virtual events. We have wonderful content on the YouTube channel, so that's another resource for you. And then we also have information about the registry. So we have something that is a registry, is that you give us permission in case you are interested to participate in research. You can join our registry, and there are a few ways that you can join. You can sign up on the QR code. You can also give us a call at the number that we'll provide on the chat. And then we have research opportunities for anyone that is over 18 years old and live in Massachusetts. And we have different categories. So you can participate in research even if you don't have any memory loss or dementia. You can also participate if you are worried about your thinking and memory and you don't have a diagnosis, or you already have a diagnosis perhaps, and there are other opportunities for you. And I think the most important one, and Liliana can also talk about this, is that we also have research studies for caregivers. So support for caregivers is very important, and there are also research studies for caregivers as well. We have the majority are in English, but we also have some research studies that are in Spanish as well. So this is a great opportunity as well for you to learn. It's free of charge. Normally, they give you, they compensate you for your time. They provide transportation as well, and it's like being doing a volunteer work. You can decide how much you want to do, and if at some point you move out of the state or out of the country, or you no longer want to participate, that's an option for you as well.
All right. So next we're going to go to speak with Eva Santos. But I think what we also would like to do is ask participants or attendees to fill out the survey. And then we'll talk with Eva Santos, who is a person with lived experience. So I met Eva because she is a research ambassador for the MADRC. That means she's been a participant in research studies, but she's also a person who sought out neurological care, and she is a patient of Dr. Ramirez Gomez. So I'm going to stop sharing. And I'm going to ask Dr. Ramirez Gomez and Eva to just kind of talk about Eva's experience seeking healthcare, also maybe participating in research.
Welcome, Eva. Thank you so much
Thank
for
you.
being here. And Eva Santos Monasterios and I met several years ago back in clinic. And Eva, why don't you share with us a little bit more about you and what got you to seek care, if you are okay sharing that?
Yeah. Making a long story short, in 1999, I was diagnosed with an arteriovenous fistula in my dural cortex. I have a strong headaches, terrible headaches, and I got that problem embolized at that time, but I continued with the headache for a long time after the embolization. So after that experience, who put my life before and after that health issue, each time I have problems or headaches, I go to look for help. In 2015, I began to have not just some kind of headache, but some kind of visual phenomena. I began to see half moon bright lights around the eyes. I didn't know what was going on. I went to the ophthalmologist and a lot of tests. They couldn't find anything. And a doctor friend of mine said, you should go to Dr. Ferdinando Bonanno, an excellent neurologist. He will help you. So I went to Dr. Bonanno, and he sent me to other tests. They couldn't find the issue that was creating my problem. At the end was allergy to soybean oil. 1 year before, I detected that I had that kind of allergy. I was taking some vitamins and happened that the laboratory to create that things changed the excipient, the oil that they used, that was olive oil, and changed to soybean oil, and that was the issue. When Dr. Ferdinando Bonanno retired, I keep consulting with Dr. Ramirez each time I have anything that seems to be out of the normal, because I didn't want to have another experience like the 1991.
Yeah, thank you, Eva, for sharing. So it's clear that you had a neurological condition that was life-threatening, for which you had surgery, and then you continue to have these headaches. At any point during your medical trajectory, have you been concerned about memory issues at all?
Well, after the embolization, I was not the same person. The first week was hard for me to get focused because the pain that was at some point unbearable. But that changed with the time. I get to be almost myself again. But lately, I sometimes forget the names of the objects. I forget some words. Sometimes I cannot remember words in English or in Spanish. I have to think about the action or the situation or how to use to remember the name or the word that I'm looking for. Okay.
Yeah. So, and have you ever seen a neuropsychologist? I know Jean and I mentioned during our visit today what a cognitive evaluation is.
No, I had no go with
Going to a
any.
neuropsychologist. Well, I'm going to give you a hint, and for everybody that is watching, and this would get us into the next topic as well. Eva, as you heard, she may have some worries about, I have these difficulties with naming or finding words. And actually, Eva, you have had cognitive testing. I'll tell you how. During the clinic visit, we discuss opportunities to get involved in research. As I saw someone here in the chat ask, how can I be involved with research? And Paola put in the link for the registry, and that's usually the easiest way. But
Yes.
how it happened for Eva is that she was my patient, and as a doctor who is involved in both worlds, taking care of the patients and also doing research, I am very aware of research opportunities in this field. And I invited Eva if she may be interested in participating in something like this. And I gave her information for her to think about and ask more questions and contact the research team. So Eva, with that, I want to ask you about how has been that participation in research, because then we are going to come back to the question of like the cognitive testing and neuropsychology. But tell us more about your experience with the research team and getting involved.
Well, so far has been very good for me in the sense that I realized that which are my failures. For example, in some tests, they gave me a long list of words. Sometimes I remember the words, but not in the same order. They read me short stories, and by my personality, I try to put all the adjectives and let with just to the nouns, happen this, happen that on the action. But sometimes they insist please give more details. So for me, it's another things. We have exercise where they show me some geometrical figures and for some second and ask me to draw the same image. Sometimes it's, for example, they show me some pictures and change the pictures, ask me to count, for example, from 100 to zero, reducing the numbers every 6 or 7 or whatever. And next, show me or ask me to tell about the thing that I saw before. Other things that we use that is very funny for me sometimes is like that. Please tell all the words that you remember that begin with the letter C, A, or whatever in 1 minute, for example. So you have to explore and begin to look for. So this kind of exercise made me think about I need to train my memory or read more or look for more things. For other days, they request a blood sample, and sometimes I go image, neuroimage is the name from that. So far, I have been good for me, and they are warm over there, very caring, and any question that I may have, they answer. And if they don't have the answer, they ask Dr. Ramirez for the information. So far, for me, has been a positive experience, and I hope that I can keep going there.
Thank you, Eva, for sharing that. It really seems you have been very involved, and you described some of the procedures and things that we do. Exactly all the tests that you described is something that can be done also for clinical purposes, meaning sometimes even if you are not part of a research study, but you go to the doctor to evaluate your memory, that's one of the tests that sometimes we use for diagnosis or evaluation of difficulties with memory. And that's what a neuropsychologist, the specialist in evaluating the cognition, does. But in research, we do it as well because we want to understand, for example, what's part of normal aging or what is not. Or we also want to understand what is the trajectory of someone's cognition. So we do it every year or every couple of years, and we follow people longitudinal, meaning we see them several times. And Eva, you have participated in research now for a number of years. How many years have you been?
I began with the memory study in April 2022. And after that, in the Boston Aging Latin Study Blast, since August 2022. So the same year for 5 months, 4 months, so difference.
Yeah, Eva has been very generous with her time and commitment because she's not part of one, but two research studies. But again, it's just to show that this is flexible, that you can get involved as much as you are able. And there is a range of opportunities that you can contribute. And with that, I think we are at 7:16, and I know Jean, and we want to open the floor for any questions that you all, the participants, may have for us and for Eva, so we can have more like a conversation.
Yeah. So that'd be, thank you so much, Eva. It's so, it adds so much, and your story is really great of describing all the various experiences and the evaluations that you've had. And that really adds to, what we've presented in terms of what we do as doctors. And that's really important. So thank you so much. So
I'm going to stop the recording now, so then everybody feel free to ask any questions either on the chat or you can raise your hand as well, and then you can share your question. Thank you.